Welcome to Quality Stream North Minute QI series, where we break down quality improvement concepts into bite-sized pieces. I am Dr. Chui and this is my digital avatar. Today, let's talk about driver diagrams, a powerful tool in healthcare quality improvement. If you're looking to solve complex problems and improve patient outcomes, understanding driver diagrams can be a game changer. A driver diagram is a visual tool that helps break down complex problems into smaller, actionable components. It guides teams in identifying the key factors that influence a goal and planning targeted changes to improve results. Let's start with the components of a driver diagram. First, we have the primary aim or goal. This is the overarching objective that the team aims to achieve. It should be specific, measurable, achievable, relevant, and time-bound. Next, there are the primary drivers. These are the main factors or components that directly influence the achievement of the primary aim or goal. Primary drivers are the key areas where changes will be implemented. Under each primary driver, we identify secondary drivers. These are the subcomponents or specific factors within each primary driver that need attention and improvement to bring about the desired changes. Finally, we have change ideas. These are interventions that address or directly influence the secondary drivers. These ideas form actions to trial as part of plan, do, study, act cycles, allowing us to test and measure improvements. Now, let's dive into an example. Imagine our goal is to reduce hospital readmissions by 30% due to medication errors. One primary driver we would focus on is medication management and adherence. So, why is this important? Well, proper medication management ensures that patients are taking the right medications at the right time and in the correct doses. When patients don't manage their medications properly, it can actually lead to complications that may require readmission to the hospital. By improving medication adherence, we can significantly reduce the chances of this happening. To improve medication management and adherence, we focus on two secondary drivers. First, medication reconciliation at admission and discharge. This means ensuring that, both when patients are admitted and discharged, their medication lists are completely accurate and up to date. Another secondary driver is patient education on medications. Educating patients about their medications is really key to improving adherence. Even if the right medication is prescribed, it just won't matter if the patient doesn't know how or when to take it. Now, let's talk about the change ideas that can make these secondary drivers work in practice. For medication reconciliation, we can standardize the process at both admission and discharge. This ensures that medication lists are accurate and consistent throughout a patient's stay. Additionally, involving pharmacists in reviewing medication lists during discharge can help identify potential issues and correct them before patients leave the hospital. For patient education, we can provide clear, easy-to-understand medication schedules and instructions. These should be simple, visual, and patient-friendly, so patients know exactly when and how to take their medications. Another effective strategy is using the teach-back method. After explaining the medication instructions, we ask the patient to repeat them back to ensure they've fully understood. This way, we can correct any misunderstandings before they leave. Similarly, we can brainstorm other primary drivers like prescription accuracy and communication, or post-discharge follow-up and support. Each of these drivers can then have their own set of secondary drivers and change ideas to help improve healthcare outcomes. By using driver diagrams, we can break down complex problems into manageable parts, helping us focus on the key areas that will make the biggest impact. Remember, it's not just about identifying the problem, it's about understanding the drivers that influence that problem and finding ways to make meaningful changes. By continuously improving these components, we can ultimately enhance patient care, reduce errors, and improve healthcare outcomes. Thank you for joining us on Quality Stream North Minute QI. Stay tuned for more insights on enhancing healthcare quality.